to everybody who's joined us already. Hi, Jonathan. So good to see you again. Congratulations on your wonderful new job. We're so happy for you. And I want to welcome everybody to thank our interpreters, as well as thank the other experts besides Jonathan who have joined us today. And then many people have joined us already, and we are recording this because many people have conflicting schedules. There's a high level of interest in this. We think this is going to be a very rich offering to support both our faculty and our students. And we hope that this is the first in a series of workshops that we can hold so that we can better support people of all abilities. And so with that, I'd like to turn it back over to Carolina, and I'm really looking forward to what is presented today. Thank you.
Thank you, Maggie. And with that wonderful introduction, I will pass it on to Jonathan, and Jonathan will be sharing with us his experience. Go ahead, Jonathan.
Well, thank you all. Thank you, Dean Margaret Baker. My name is Jonathan Balisi Manalang, and I am a December 2019 graduate, and I'm currently an RN at Loma Linda University in Southern California for my residency. Thank you, thank you. Now, you may be wondering as to how this workshop came about and why I decided to set it up. As Dean Baker mentioned, it started all the way back in October of 2019 when I participated in the Best of Student Success event to showcase my poster work. And I was honored to receive the Provost's Realizing Their Mission Award, which awarded to me with some funds. And I decided to invest those funds into this workshop, giving back to the USF community and also with help from the Hearing and Speech Center, which is just 5 minutes away from USF. I'm very excited to be here and to share my experience as a former USF BSN student with you today. Even though Student Disability Services, and I'll reference that as SDS, supports deaf and hard of hearing students well, and they provide resources that we need, there needs to be a bridge to support faculty to better serve, reduce the burden, and ensure the academic success of these students. A key rule, not just for deaf and hard of hearing, is that there is no one size fits all. Everyone is different, so always keep in mind that each student will have a different experience. I'm going to discuss 3 main points regarding what I experienced within the School of Nursing and Health Professions, with my hope that at the end of this workshop, my experience will increase your knowledge, skills, and resources to teach and work with deaf and hard of hearing students in the future, as well as working with SDS. So my first area I'd like to talk about is accommodations. Videos and materials for class sometimes are being shown without proper closed captionings. Many times you may find, last minute find a great video, but it has no captioning, which means then for the students and for the interpreters, means having to interpret for longer amounts of time, and potentially it becomes very exhausting for the student to have to pay attention to 2 areas of focus, the lecture and the interpreter. And sometimes there's not a lot of communication between SDS, the faculty, and the staff at the beginning of the semester. Of course, the faculty might be overwhelmed at the beginning of a new semester with so many new students, and sometimes SDS emails, which are sent out to notify them about students with student accommodations. However, some faculty miss those emails or make assumptions that everyone's needs are the same. Sometimes some faculty do not really become involved with SDS to ask more questions about how they can better support their deaf and hard of hearing students. The faculty was shocked that I had several accommodations that they were not familiar with, and it added another burden that I had to educate them about my needs that are not the same as other deaf students while trying also to continue my studies. Some faculty assumed that I used real-time captionists instead of interpreters, but I had to educate them about their assumption that that wasn't correct and that not all deaf and hard of hearing students use real-time captionists because it does not work for my certain situation, as the captionists are not able to speak for me when a professor asks me to participate and answer questions in the classroom. Office hours is another area. It may be difficult for me to be with other hearing students during the office hours, since sometimes I feel unable to participate in the group, and it can be challenging for me to keep up with them compared to situations where we are working one-on-one. The second point that I'd like to talk about is communication barriers. Professors or fellow students often talk too fast or too slow, but it doesn't help me to understand if they're talking more quickly or slowly or louder. It really doesn't make a difference. Also, professors or fellow students, sometimes they shout or speak too soft. And then again, that doesn't help the interpreters or the students to understand any better. One time when a student spoke too softly and the interpreter couldn't hear, I had to advocate for myself to ask them to please speak up. Then there's also the area of group discussions. It may be challenging for deaf and hard of hearing students and the interpreters to participate in group discussions because the room can become very loud when everyone is talking at the same time. And sometimes interpreters have to ask the group to speak up even louder in order to be able to interpret the conversation, or else we may have to move our group out into the hallway or another classroom to be able to interpret and understand one another better. Another communication barrier is people speaking with their hands in front of their mouths, or they're speaking to the board, or their face is not visible to the deaf and hard of hearing students. And now with COVID, masks prevents deaf and hard of hearing students from being able to lip read and be aware. Also another area of be aware of the lighting. If it is a source behind your face, which then darkens your face and makes it difficult for us to be able to lip read. We can't see you or what you're saying. The last area is the use of interpreters. When instructors are pointing to the board without identifying what they're talking about, that becomes an interruption in the flow of information, and the interpreter has to turn around to look at the board and sometimes even ask the deaf student specifically, what are we talking about at this point, because the reference hasn't been mentioned. The interpreters, another problem is that often they do not get materials or slides at the beginning of the semester. And some interpreters may not be familiar with nursing terminology, and they want to be prepared before the lecture in order to provide high quality educational services for deaf and hard of hearing students. And sometimes the professor asks the interpreter to ask the deaf students instead of speaking directly to the students. They say, can you ask him or ask her or tell him? When really they should just be addressing me directly, saying, Jonathan, do you have any questions? Finally, not all interpreters know medical terminology, and they have to ask the instructor to spell it out because, for example, words sound similar, like I and O can be misunderstood as being eyes and nose, or CVC could be misunderstood as CBC, which is something that I had to figure out myself to which was the professor referring to. So in conclusion of my presentation, I would now like to let Jessie Johnson from the Hearing and Speech Center lead a discussion about best practices for deaf and hard of hearing students. Thank you.
Thank you, Jonathan. So hello, everybody. I'm going to share my screen and go through a presentation today. Let me just get that going. So Jonathan reached out to the Hearing and Speech Center last year. We have known each other for a long time. He was one of my favorite students here before he became one of your favorites over at USF. And we talked a lot over the last year, really, about some of the challenges that not just he went through, but a lot of my coworkers have gone through, and a lot of my clients that come through the Hearing and Speech Center. So we talked about not just his experience, but everybody's experience, to try to get a great snapshot of how to give you information and resources as faculty so that you know how to work better with a student, so that everyone can have success in the classroom. So you already know Jonathan. I am Jessie. I'm the director of our Counseling and Outreach program. I've been working at the Hearing and Speech Center for 20 years. And I do a lot of presentations throughout the community to educate people about hearing loss, their own hearing loss, to educate professional staff that work with older adults around hearing loss, and how to use tips and tricks to better communicate. So this was a great new experience for me, working with Jonathan and Carolina to create this workshop for our students in the classroom. And Dr. Focht's going to speak afterwards, and he's a great resource as well, because not only is he an audiologist, but he's also faculty at San Francisco State University and teaches class there. When we were putting this workshop together, I reached out to your SDS program based on Jonathan's experience there, and I talked to Partners in Communication, which is where our interpreters come from. I spoke with Kitty Baca. She is the service provider for captioning for San Francisco State, University of SF. And I also reached out to a couple other programs where some of my coworkers had experience going to college, their disability programs, to see what resources they use and what's helpful for them. And we had some really good feedback from them as well. And again, today we're just trying to make sure that everyone's more sensitive and has the knowledge that they need and resources at hand to teach hard of hearing students that may also have other disabilities as well. So to dive in, really, I want everybody to understand the uniqueness of having hearing loss. So when we're diagnosing the type of hearing loss, we have really 3 different areas here. I don't know if anybody loves Venn diagrams like I do, but I found this one and thought it was great. So we have sensorineural hearing loss, where we have some type of damage to the nerve. We have conductive hearing loss, which is where we have the sound not getting through to a working cochlea inside. And then we have sometimes people who have a mixed hearing loss, who have a little bit of both. And there's all different reasons for these things. To the result of hearing loss can be for a lot of our students that we're seeing, or just anybody who has hearing loss. The most common, usually, when we're working with a student is there was some kind of genetic disorder that happened in the early stages. And most of my students that are coming through, most of the students you see, will have hearing loss that they were born with. And that could be stable, or that could be changing throughout their life. But you might have some people who got hearing loss later on in life, and that could be for other reasons. So you have someone who may be used to having a hearing loss, who developed their unique needs to be able to communicate since they were early in infancy and early in childhood, who maybe got hearing aids or started learning ASL when they were very young, And so they have their ways of interpreting sound and information. That's been happening for them for a long time, and they really know what they need to communicate. And then you might have someone who has hearing loss that's new to them, and they're still navigating through that process, depending on how they just got that hearing loss. So, you know, the type of hearing loss somebody has can really determine the way that they're going to be able to communicate. And then you have degrees of hearing loss. So we have what we call normal hearing, and then all the way up to a profound hearing loss. And there's categories all in between. And really, when you meet somebody who has hearing loss, they could have a mild hearing loss and they could have a very difficult time understanding speech, or they could have a profound hearing loss and they do really well still understanding speech. Just it's the way that their brain is able to interpret and use the information, the visual cues and the different things that their body has adjusted to with their hearing loss. So the degree of hearing loss, it's vastly different for everyone. And it makes a big difference on the information that they're going to be able to get in. So just like looking at like first, you know, what type of hearing loss they have, now the degree of hearing loss, we have a lot of different stages in there that somebody could be. And then we get into the technology that our people are using, which is vastly different. So you could have someone who's using nothing, really. They don't use any device at all. A lot of my clients who are deaf with a capital D, that use ASL as their main form of communication, their primary language being ASL, might not use any listening device or hearing. But most clients who have some type of moderate to severe will use some kind of amplification, especially if their primary language is oral, spoken English. They're going to use some type of amplification. That could be a over-the-counter, something simple we call a PSAP, or pocket talker, something that's just really super simple, that's just making things a little bit louder, to a custom hearing aid, which is specifically programmed for someone's hearing loss, and hearing aids and cochlear implants where they've had a surgical implant done for their hearing loss. All of these different types of technology, very different for everybody. Their ability to use some of this technology, some people are really up to speed, have everything set up with program, new technology, and some people might have older technology that they need more support with, or very basic. Hearing aid technology and cochlear implant technology is super high tech now. We can connect to Bluetooth devices. We can have remote microphones. So you might have a student in your office that has an FM system or a remote microphone that they're going to ask you to wear, like a lapel mic that you're going to wear, so that sound, the microphone here, is going to pick up your voice and it's going to send it directly to the person's ear amplification, so hearing aid or cochlear implant. And it's really important to be able to know how to use those, because if that's the accommodation that your student needs, it's going to be really helpful for them it's going to be like they're standing next to you hearing you talk, because the microphone is going to pick up and send directly over to their hearing aids or cochlear implant. So knowing what your student uses is often helpful, and understanding what type of hearing loss they have or how significant their hearing loss is might help you navigate this world of working with a deaf and hard of hearing student. Mostly I want to talk about it because it's so unique. Everyone's hearing loss is so unique. Two people can have the same, I always say this, so you can have the same degree of hearing loss, wear the same exact hearing aids, and their communication needs are going to be different, because our brain is what interprets the sound, and that's unique for everyone. So there's no one, like Jonathan was saying, There's no one size fits all for anyone. It's unique for each person. And so finding a solution that works when you're in the classroom together is unique for everyone. So you can't just say, well, I had captioning available. That works for everybody. It might not work for everyone. So that's why finding out at the beginning of the semester how to work with that student is so important. So just think about that when you have a student who comes to you that has hearing loss. I liked this slide. This picture here came from Gallaudet University. Gallaudet is the #1 university in our country that for deaf students. And there's so many different ways to identify when you're deaf or hard of hearing. So this is a picture that they have on their wall about how the deaf students identify at Gallaudet. But people that are deaf or hard of hearing, we kind of use a few different terms. So I just want you to understand that when someone's referring to themselves or talking about their hearing loss experience. So deaf with a capital D is most often used for someone who uses ASL as their primary language, and they're immersed in the deaf community and deaf culture. That's what we mean when someone's capital D deaf. Someone else might say they're deaf, but they are not using the capital D. They are saying that they became deaf later in their life, or they don't use ASL, it's not their preferred language, they don't identify with the deaf community, and really they're just referring to like the severity of their hearing loss. Then we have hard of hearing. So hard of hearing is really inclusive. It's many areas of hearing loss. So someone who has a mild to moderate hearing loss or even no hearing loss might identify as hard of hearing if they have challenges understanding people. And then you might have somebody who identifies as deaf and has strong ties to the deaf community, but also considers themselves hard of hearing. Another term that's out there is hearing impaired. And I would refrain from ever calling someone hearing impaired unless they identify themselves as hearing impaired. It's an older term, and so most people don't really like the verbiage. So I wouldn't ever call anyone hearing impaired unless they told you that's how they identify. So you're deaf, capital D deaf, or hard of hearing usually is the terminology we use for anyone who has hearing loss.
Little break periods that I'm not sensitive to.
Okay, thanks, John, for asking that question.
This is Jonathan. If I could make a comment.
Please.
I think sometimes, it is great if instructors offer a 5-minute break or even just a 5 or 10 minute break periodically.
I teach 3-hour classes out at San Francisco State when we're in class, and to go 3 hours without a break would be inhumane for practically anyone. So generally what I will do is I will start a lecture with PowerPoint slides or whatever, and about halfway through that, we'll take a 10-minute break, let people go out to the restroom, buy coffee, whatever, and then come back. The interesting thing is that when I take these breaks, all these students come up to me and ask me questions about the lecture or what they've heard or this and that. And this is the time when they should actually be going out and getting coffee and using the bathroom and not thinking so much about it. I have had very few hearing impaired students in my classes, but I can guarantee you that those that I have had, during those break times, I seek them out and confirm that they are on the same wavelength with all of the students in the class who can hear adequately. So it's not a break time for me. I go out and make sure things are working properly for everyone involved. So that's, yeah, it's tiring. It's tiring to pay attention to more than one input modem at a time. If you've got a deaf student who is watching an interpreter, reading slides off the board, and perhaps taking notes or reading notes, it's a very, very challenging situation and quite tiring.
Yeah.
Thank you.
Hi, I'm Susan Prion. Hello, Jonathan. It's so wonderful to see you.
Hello. Good to see you again.
And Rick, it's nice to see you again also. I have a question, and I'm not entirely certain. Well, I'm just going to blurt it out. How do I, as a faculty member, make sure that I am accommodating to my deaf student, but also not calling, embarrassing them or calling additional attention to them in the class? And I apologize, that's a badly worded question, but I can't think of a better way to ask it.
Well, it's a fine point, though, and indeed it needs to be looked at. We don't want to isolate people or make them feel like they're less or more given attention to. What I generally wind up doing is sending out all of the information I'm going to cover to the students that need it ahead of time. And they're not necessarily always deaf or hard of hearing students. I have others who are simply not as accelerated learners as others. And so I make sure that at the beginning before the lecture, that I've contacted these folks through email or what have you, and gotten some of the material to them ahead of time. That's
So it was in fact a badly worded question. So thank you. That's actually helpful. I guess maybe what I was thinking more was in class. Jonathan and I had the, at least it was my pleasure, to spend a semester together. And Rick and I think Sarah, you were also, you would join us. And so I guess it's in the classroom, making sure that I am meeting everyone's needs, but not calling anyone out or making it more uncomfortable. Does that maybe focus it a little bit more?
Yeah. It doesn't have to be uncomfortable.
Okay.
And indeed, if you'd be surprised how mature these students are these days, and most everyone in a classroom will be appreciative of the accommodation to the deaf or hard of hearing student. So I'm not sure that the sensitivity issue is going to be a problem, or shouldn't be a problem.
Okay.
On the other hand,
thank
you do
That's
want to be
actually reassuring.
you do want to be aware that there are some people who do not wish to be identified as having special needs, and that should be taken care of before classes ever even start. When you sit down with a student, which I do, I sit down with my students and I say, okay, what are my limits? What are my ground rules? And I let the student be the teacher, and let them tell me what they need and how comfortable they would be with certain things. So it's helpful to just be on, to talk to them ahead of time.
Great. Thank you.
I'd say, Susan, in my experience, most of my clients and friends who have hearing loss, if you've talked talk to them at the beginning of the semester about how to handle those types of things that come up in the classroom. Most of the times, if you do some sort of check-in, they're appreciative of that check-in to make sure, you know, that they're following, that they're there with you in class. And sometimes, I'm not sure, maybe our interpreters, Rick or Sarah, can jump in, but I know with captioning, with our captioner, you know, if they feel like they can't keep up with you or something's happening in class, they might even insert themselves at that time to say, hey, I didn't catch that, I'm not following along, or I don't have access to that information, to make sure that they're able to present that to the student as a service provider. And a lot of times you'll talk about that at the beginning of the semester. So that's in place. So we know how to handle the situations when they come up. So it's not uncomfortable.
Yeah, and this is Jonathan. I just want to throw in an extra comment. I think that those are some great ideas in terms of sitting down with the student before the course starts and discussing. The student can explain what their needs are, how they prefer to communicate. And then also SDS is there to be able to support the instructors and the students. And possibly you could check in with one another every couple of months. And that could be done just via email to the student saying, is everything going okay? Are the accommodations satisfactory? And, you know, and now I'm in my residency program. I'm really surprised that some of the people I'm working with that are emailing me and checking in with me is in terms of how everything is going. And then, you know, we're both taking action to make sure that access and my experience is successful and that everything is coordinated and proceeds very smoothly. And, you know, and these are people who have not worked with, you know, me or another deaf student before. And, you know, it takes a lot of a burden to educate people. And, you know, you have to take it one step at a time, but I definitely agree that the instructor or professor to reach out and be assertive and just email and contact the student to say, how's everything going and what can I do differently, or is everything good?
So thank you for your questions. And we'll be able to do some more of this at the end as well. So I want to go through types of accommodations. If you're not familiar, there's also a resource handout that we sent. I think, Carolina, you sent it in advance, but also we'll have a link at the end.
We're going to send it at the end, yes.
Okay. A great resource catalog, really, from the University of Cincinnati that explains hearing loss, degrees of hearing loss, and accommodations really well. So I want to just kind of go through what you might see as an accommodation for a deaf, hard of hearing student if you've not seen this in the past. So CART is a real-time captioning of what's happening in the classroom. So it's not just the faculty presenting that is being captioned, it's everything that's happening in the classroom. The captioner and the student might decide that not everything needs to be captioned throughout the semester, but some students might want to know, you know, before class starts and the captioner's there, that there's somebody speaking behind them so they can participate in that conversation that's happening in class. And other kids might not want that at all, but the captioning is happening real time for everything that's happening in the classroom. ASL interpreters, we have two with us today, and they do the same thing. If something's happening in the classroom, they're going to share that with the deaf student, and they're going to interpret everything that's going on, not just what the faculty or the presenter is doing. FM systems or assistive listening devices are really a common accommodation. That's what I was talking about earlier with those microphones, those lapel microphones that you might be asked to use or wear. And you're just going to want to, you know, have a rundown with the student about, or SDS about how to use those in the classroom. but it's essentially just a little microphone usually that you'll clip on to your shirt. You'll speak in, or a lanyard around your neck that you'll wear. You might have note takers. You might have a student who needs preferential seating in the classroom. And it's always good to have visual and written announcements and email correspondence as an accommodation for all of our deaf and hard of hearing students. So you might have a combination. You might have a ASL interpreter and a note taker, or you might have CART and an FM system. So just know that there's different, like we were talking about that unique fingerprint. Every student might need different accommodations or multiple accommodations in the classroom to make sure that they're accessing all the information that's going on. And also, as Chris was saying, things are different now with everybody meeting virtually in Zoom, right? This whole workshop we were supposed to do in person, like in March or April or something, and then we had to shift gears, and here we are Zooming with each other. So making accommodations for even some of these new virtual learning is different too, as far as having a CART or an ASL service provider there. So getting set up maybe a little bit earlier for your students who need those things, making sure they can get into the classroom early to make sure that those are set up. So CART, just the key points of working with the captioning services is always make sure that you're speaking directly to the student and not the service provider. The service provider is just there to provide that service, but the student is the person you're communicating with. Making sure you're sharing classroom materials and lectures for lectures in advance so the service provider can prepare. So Jonathan spoke to this as well when he was sharing his experience, but some of this terminology that's being used, you know, the service providers aren't students in your classroom. They might not be, or probably are not aware of the terminology or acronyms that you might use. So making sure that information gets to them in advance so that they can study. You would be amazed how much our service providers prepare for our students. They study, they're right there along with the students in the classroom. Making sure that your videos all are prepped in advance because we do need to get captioning. And John, when you asked about getting exhausted, I think this is an area, videos are really an area where it's exhausting because you're watching. I don't know if you've ever used closed captioning on anything in your own house, but if you're trying to watch and read at the same time, or watch a video and watch the interpreter at the same time, it's taking a lot of resources for your brain. So I think videos, although they can be really great teaching tools, can also be very exhausting, not just for the student, but sometimes for the service provider as well. There's a video that Caroline and I are going to share later on about interpreters that I found that's really interesting to see how much energy it takes to actually interpret this information. So if you think about how exhausting it is for interpreters, yeah, it's also exhausting for the student. So videos take up a lot of energy. One of the big things I think to learn as a faculty having a student that's deaf or hard of hearing in your classroom is managing turn taking. It's a really hard thing for some people to do, but it's really important during class discussions. And depending on who your student is, if you know, they might interrupt and ask to remind you about turn taking. My coworker Barbara is great at that because when you get a good class discussion going, or things can get heated or exciting, you can sometimes get going really fast and everybody's bouncing ideas, and it's great, but it's also really hard to follow. So to make sure to slow everybody down and make sure that we're taking turns speaking so that the student can make sure they're transitioning to follow who's talking, but also for the service provider to be able to keep up with the conversation. And I was going to tell you, my coworker Barbara is great at this. When we kind of get going talking about something at work, she'll say, "Excuse me, please talk, speak one at a time," because we all have to be reminded. So it's a skill that is great to learn if you have a student in your class that's hard of hearing or deaf. And then be mindful of your speaking volume and speed. Jonathan brought this up during his presentation. Just, speaking, you don't have to speak louder, just speaking at your regular volume. But also, if you're speaking too quietly, it might be difficult for especially the service providers to be able to pick up, so that they make sure they're getting the information correctly. And the speed in which you talk. I am a really fast talker, so it takes a lot for me to remember to slow down, especially when I'm presenting. Sometimes, in the classroom, you're looking at the time, you want to get through the information before the end of the class, and you might start speeding through it. So just be mindful if you're doing that, if you start feeling that, to take a step back, slow down. And I was just saying about getting those Zoom links to the service providers in advance, because it does take us extra time to get set up. When we need to connect, all these things happen in the background. Maybe we should have started recording earlier, Carolina, where we were talking about, okay, who's going to be on the screen, so see who's talking. I might have to pin, if I'm the student, I might have to pin my interpreter so that if you start presenting, I don't lose my interpreter while you start talking. And I need to make sure my interpreter is there, especially when there's so many other people on the Zoom call. So being able to get set up in advance is really important. So even just 5 minutes in advance to make sure everything's working. So those were some of the key points for working with the captioning or the CART team, but also all of those things would apply to working with a ASL interpreter, as well as sharing videos in advance, so that if they're not captioned, so that the CART and the CART service provider can help get the captioning set up, but for the ASL interpreters, so that they are able to watch the video and prepare if they need to interpret the entire video, if there's not going to be, or even if there is captioning. So those videos, again, are really important to get to the student and the service provider in advance. And just know when you're working with these interpreters, they have a code of conduct. So there's a National Association for the Deaf. They are, their interpreters are there to provide the communication, and all of the things that they're communicating is considered confidential. That's why they can come to my doctor's appointment with me and interpret anything at the doctor is covered under HIPAA. So any of your lectures, anything that you share with them is considered confidential. So you don't have to be hesitant about sharing it with them in advance. It's only helping the interpreter and the student be able to get the information to the student the best way possible, without any pauses and struggles in the classroom. And just so know, and I'm providing you all with a copy of their code of conduct at the end, so you can read through it yourself and see that all of this information that you might share with them is confidential. Sorry, my little gallery view is taking up too much of the room on my screen, so I can't see my slides. Okay. So getting the schedule to the SDS department as soon as possible at the beginning of the semester is important, because we want to make sure that the service providers that your students are getting can get scheduled to be in class consistently. So, if Rick and Susan are going to be my interpreters for John's class, it's great if I can have them there every single day so that they're up to speed with what's going on. If I have to get another interpreter in or a different captioner in that's not familiar with the way the classroom works, the terminology, they might not be able to provide the best service at that time to the student. So if the SDS department knows in advance your schedule, they can try to book the same service provider throughout the entire semester, which is really helpful for everybody working together. So get your schedules over to SDS. And this is something that we talked about a lot, is when you're gonna assign any kind of work outside of the classroom. Students need about 2 weeks advance notice to get a service provider for that outside of classroom work. So, you know, if you say, okay, I'm going to assign group work, I want you guys to do this, you know, it's going to be due next week, and they have to go get together as a small group outside of the classroom, your student might not have an interpreter or a captioner there to assist them in that group work, so they're not going to be able to participate. So the students need to know 2 weeks in advance, because the students do the request for the service providers. So they need to get about 2 weeks notice. It's a little bit less right now with all of our virtual learning. Sometimes I can get an interpreter quicker, but I would say as rule of thumb to just keep in your head 2 weeks, because when things do shift back to normal again, it's going to be 2 weeks. And that would be, you know, that's what, when I need to schedule an interpreter for anything from my office, I know that I need about 2 weeks notice as well. So just know that you could be putting your student in a difficult situation if you assign something like group work or something outside of the classroom and without that advance notice. And then keeping your group work to smaller groups so that the service provider can keep up with the multiple speakers. And also a space where if you're in the classroom and you're doing that small group work together, that the service provider can hear and follow along with all the speakers. So, you know, that might be where Susan was asking about, without calling somebody out in the classroom, making them uncomfortable. I would say that, like, this is a situation, Jonathan will probably agree, that don't worry about that. Make sure that the interpreter and the student that are in that group have the right space and the right amount of students so that that group work that they're going to do together is effective for everyone. So some of the biggest challenges happening in the classroom is going to be non-written information, following videos, the group work, and then environmental changes or changes to the speaker. So it's not something that you might not think about, but if you're the presenter all the time, especially like right now with the Zoom, I'm presenting right now and you all might be able to hear me great. My audio is working great, but all of a sudden, John starts talking and his microphone's cutting out and it's choppy, and he's going to present for the next 15 minutes. And suddenly now the interpreters can't follow. So just know, whenever we're making a type of change like that, where the audio or the environment's going to change, the service provider has to change to be able to follow along. And that's where we might run into challenges. So Susan, again, like, this might be an opportunity to say, is everyone able to hear okay? Is the audio working? Something, just doing a check-in like that. And that might give the student an opportunity to say, no, I'm not able to hear, or it might give the interpreters a chance to jump in and say, there's something happening with the audio, I can't hear. So whenever you're doing environmental changes, we're going to move to another space, or changing speakers, that would be a good time to do a check-in and find out if everybody's able to follow. And yeah, in the virtual classroom, one of the biggest things that has been coming up, like I was saying, is is the different mic levels for everybody, but also not muting the non-speakers. So you got to mute everybody. Unfortunately, you need to just, if you're in control, if you're the host, just put a mute on everybody and they can unmute themselves if they need to ask a question. But if they're not muted, you know, somebody's dogs, but you guys have, you know, you've been doing it for months, you know, the dog starts barking, all these things. So making sure everybody's muted. And then just know that Zoom still does not have built-in captions. So a lot of the other platforms that we use, like Microsoft Teams, the Google services, Skype, a lot of those provide different platforms will have built-in captions, and some of them are really good, but Zoom still hasn't done it. My coworker yesterday showed me on the new Zoom download, you can have this, like, you can add in like all these like framework and like glasses on your face and all these goofy things that you can do in the classroom. They still haven't got the accessibility to have captions there. So if you have, you know, if you're talking to a student and there's a better way for them, if you needed to do a one-on-one besides Zoom so that they could have captions, especially if that's the way that they like their accommodations is to have captions, maybe you can find a different platform to communicate, like Skype or Microsoft Teams or something like that, and then it'll be easier for them to do a one-on-one with you. And like I was saying, setting up the things early, like pinning where the interpreter is going to be or the speaker is going to be, all those things are new for some students to learn. And you guys know, because you've been using Zoom, you're like, oh, I didn't know it could do that. So it's a learning process, especially if new students coming in, you know, for next semester, they might not be used to using some of the services that are available, or the services might change, like technology is changing us all the time. Some of the communication strategies that I wanted to share and there's a ton of them in the handout, but I liked these because they had like visual to go with, so it kind of helps you. But something that one of my colleagues that works for a cochlear implant company, she does some oral rehab therapy. One of the things she said, which I thought was really helpful, was putting space between your words. I think sometimes when you get somebody who's hard of hearing or deaf and you're communicating with them, you sometimes start speaking louder than you need to, and you speak slower, and it's not really slowing down, it's more putting this kind of space between your words that helps people understand. So think about that. Making sure you're taking turns speaking, one person at a time. That's really important. Be sure to face the person you're speaking. So many people who are deaf or hard of hearing are going to use lip reading skills. Speech reading is what it's really called. And just facial visual cues. So it's really important for them to be able to see your face and try to stay in one place, because if you're moving around, it's harder to follow you and keep eyes on your face. So staying in one place and making sure you're facing your listener, and then having visual cues. So anytime you can write on the board, but remember, if you're writing on the board something, to make sure you verbalize it as well. So not skipping that part. But I just liked these little pictures that kind of go along with some of these communication strategies, because if you look at it visually, sometimes it's easier to think, especially that speak one at a time, and how if it's layered, it kind of makes it, oh yeah, it's really hard to pick out who's talking.
So Jessie, Chris, I would like to start wrapping up. If you want to summarize some of the key, I know that we're going to send a checklist too. I don't know if you want to talk a little bit about that. And then just really wrapping up some of the key thoughts that we've had throughout preparing for this workshop. Jonathan, too, if you wanted to join in your summary or last thoughts.
I'll jump in. So I definitely definitely know that, you know, any deaf or hard of hearing student, just like any student, you know, you have some exceptional ones and maybe some that are not so exceptional. Jonathan, from everyone that I've heard, has been an exceptional student, and was able to really overcome some of the challenges that happened to him throughout his experience there. And that was the whole point of this workshop, was to try to make sure that some other students maybe who aren't so outspoken or knowledgeable or exceptional can rise above some of the challenges, because they won't be there. There won't be as many barriers for them. But I think for me, some of the key points that came up were, you know, just the preparation that's needed for our service providers that are going to be in the classroom. That everything you share with them is confidential. So be sure to, like, as much prep work you can as possible for your students is really important, and connecting with them to make sure that their accommodations that work for them, because it's going to be different for everybody. What worked for Jonathan's not going to work for Jessie. So, you know, making sure that you check in with them to find out, how are we going to get through this semester together.
Yeah, it's important to remember that education is a two-way street. We learn from our students learn from us, but we meet in the middle and exchange what we need to get out of the situation, both as a professor and as a student. And if we can get on that, level that playing field, it makes a great deal of difference and makes the semester go by so much easier on everyone. So it's very, very helpful to be aware that there are going to be special needs that need to be accommodated. And on the other hand, we can't spoon feed everybody. On the other hand, we can't ignore anybody. So there you go.
Jonathan, do you have any closing?
Just wanted to say thank you very much for coming to this workshop and taking the time to listen. And thank you to Jessie for all of her explanation about deaf and hard of hearing culture. I hope now you have a better understanding of how to work with your students in the future. And the more knowledgeable you are now, the better you're able to support your students' needs. And you know that SDS is always there to assist you in working with your students. So make sure to make use of their resources. There's a great team there. I'd like to thank them again for all of their hard work. And it's so wonderful to see so many familiar faces as well.
Thank you all for coming. Have a wonderful rest of the day and happy Friday.
Indeed, it's going to rain. All right.
Take
Thank
care.
you.
Thank you, Jonathan,
All right.
Jessie,
Bye.
Sarah, Rick, Chris. Thank you so much. Thank you.
Thank you.
Bye, everybody.